This is Carolyn Smaka, Editor-in-Chief of Audiology Online, and today I'm so honored to have with us Dr. Neil DeSarno, Chief Staff Officer of Audiology at the American Speech Language Hearing Association. Welcome, Dr. DeSarno. Thanks for your time today.
Thank you, Carolyn.
So today we're going to be speaking about the new World Health Organization initiative called Make Listening Safe. Tell me, why did ASHA decide to get involved with this initiative?
That's a great question. ASHA really saw this initiative as really following in the footsteps of what they've been doing for several years in their Listen to Your Buds campaign. When we were asked to participate as part of this WHO effort, it seemed to fall in line with what's been happening with a relationship ASHA has been fortunate to develop with WHO.
So how how will ASHA exactly be involved with this campaign? What will ASHA's role be?
ASHA will primarily serve as an advisor to the WHO campaign. They'll expertise and feedback as WHO develops its materials, their publicity plan. And part of that publicity plan is to actually establish what WHO is referring to as International Ear Care Day.
So tell me more about that. I haven't heard of International Ear Care Day.
Well, International Ear Care Day is going to take place in Geneva, Switzerland on the 3rd of March. And what has happened is WHO has pulled together experts from around the world who are interested in getting the message out about preventable hearing loss. So they're having a one-day symposium, pulling all these experts together and utilizing their expertise in developing their campaign.
So tell me why this is a worthwhile campaign.
Well, we know that hearing loss is increasing, and we know that that increase includes children and adolescents. So if even some of the hearing loss was preventable, which we know hearing loss caused by noise exposure can be preventable, we believe that it's worthwhile to take part in this effort to actually reduce the negative effect of excessive noise or recreational noise on hearing.
So what do you hope the outcomes will be of this campaign?
Well, certainly one of the outcomes should be greater public awareness of the risk of hearing loss, of noise-induced hearing loss. Also, greater awareness among public policymakers worldwide certainly would be a notable result of this campaign. Getting the medical community and others who have influence over such preventable illnesses certainly would be a great outcome. Certainly the awareness can not only increase the longevity of health with individuals, it can actually save money in the long run. So a worldwide campaign such as this can have major benefits.
So how can audiologists get involved in this?
Audiologists will be able to utilize the materials that WHO is putting together, and they'll be able to use those materials in public education campaigns, certainly within their professional circles. They can use them with parents, with friends. They can also schedule screening events where they can showcase these materials. What the Buds campaign has done throughout the past several years, they've actually gone into elementary and high schools to teach students about the effect of noise on hearing and how important it is to preserve hearing. Certainly audiologists, and many are doing this, but here are some great materials they can use if they haven't been doing it or if they want to enhance some of the efforts they've already done. They can also contact news outlets. Media really is interested in this topic. We've seen an awful lot of interest in hearing loss and prevention of hearing loss in the media for the past several years. So I think audiologists can contact their local TV stations, they can contact their local newspapers to talk about how important this campaign is and also get the word out.
What about social media? Do you think that would be an effective tool to help spread the word about this exciting campaign?
Actually, social media with this population, as you know, is very popular. It's actually able to touch more people than more traditional media, such as newspapers or newscasts. Um, Something like this can actually be more exciting and more it will hold the attention of young people certainly a lot more than other traditional forms of media. So, um, and audiologists are utilizing social media in so many different ways these days. This is a great opportunity to get such a campaign out.
Sounds awesome. Where do audiologists go to get on board? Where can they get more information from?
If they want more information about this campaign and the Buds campaign, they can go to the ASHA website, which is www.asha.org/buds. At that website, they can find out how to actually involve themselves in projects that already have been going on, how they can mimic certain projects. If they'd like some professional advice, they can write to pr@asha.org and they can either get correspondence back and forth or they can be in touch by phone with an ASHA PR expert who can give them advice on how to utilize these materials in their own practice.
Excellent. Well, thank you so much for your time, Dr. DeSarno. I'm going to go talk to my boss about getting a ticket to Geneva for March 3rd, and we look forward to hearing more about this exciting campaign. Thanks again for your time.
Thanks for this opportunity.